My name is Charlotte Howden, and when I was pregnant with my son Henry, I experienced significant health challenges that also impacted on my mental health. I've since discovered that pregnancy and early motherhood is a time when women are most at risk of developing a mental health condition. And shockingly, suicide is now the leading cause of maternal death. In this film, I'm exploring one of those conditions, complex PTSD. I've heard of PTSD, so post-traumatic stress disorder, but I haven't got a clue about complex PTSD. So today I'm going to meet with Dr. Christine Dunkley, a consultant psychotherapist who has over 30 years clinical experience, just to find out a bit more about what this condition is.
Complex PTSD is in a range of stress disorders that occur after someone has had a series of incidents that have caused them to feel very unsafe, of feeling that their life was in danger, that they were completely out of control. And in complex PTSD, it's because this has happened over a period of time and not just one incident, but many incidents.
Can you describe to me some of the symptoms that you might suffer with if you had complex PTSD?
So the main symptom that people are disabled by are intrusive mental events associated with their trauma, with their period of trauma. So that might be flashbacks, it might be thoughts about the incident, accompanied by really severe symptoms like heart racing, panic feelings, your vision may be disturbed. Because this is so traumatic, people avoid triggers. So they try and get away from anything that might remind them of that period of trauma.
This sounds like quite a simple question, but why does this happen?
As far as your brain and your body are concerned, the survival of you as an organism is much more important than your happiness or even your functionality. Your brain doesn't care if you get to go shopping or get to play with your child or anything like that. It's just, will I die? It's asking that question. And because of the history of getting so close to feeling you might die or it's completely out of your control, then your brain is setting up alarms all the time to stop that ever happening again.
As a mum myself, I really want to know what it's been like living with complex PTSD. So I've arranged to meet with Natalie and her family to find out what life has been like.
As a child, I had quite a traumatic upbringing. I had a mum who was bipolar. So when she was well, things were amazing and childhood was lovely. But when she was poorly, which was quite frequent, things weren't so good. And then when I was 11, she took her own life. And then 3 years after that, I got abused by a school teacher when I was at secondary school, which then I think started events off really with the complex PTSD. That's how I think it stemmed from that.
So when do you think you realised that you needed to take some steps to perhaps getting some help and then eventually a diagnosis?
When we had our first baby, things got progressively worse. When I had my third child, things kind of got too much. I couldn't manage my emotions, especially when I was pregnant. I couldn't manage daily life on top of the other things that I should have been able to manage. And so I just lost, I guess I'd lost myself is the only way to describe it really.
Can you summarise some of the symptoms that you experienced?
So I'd avoid places. I'd get anxious on the build-up to going places. I would also pick my skin. I'd have that as it was like a very hidden habit. And if I would smell certain smells when I was out, it would take me right back to the moment that was traumatic and it would, from my childhood, and I would be right back there. So I would then avoid that place again in the future. So it made going out and having a normal family life really difficult. And I wouldn't always explain to Phil why I couldn't go to these different places or why it was difficult. So a lot of it, I was very secretive as well.
Talking with Natalie, it's becoming more obvious that complex PTSD doesn't just affect the sufferer. So I'm really keen to speak to her husband, Phil, to learn more about what he went through.
There's been many a night where we've had a really rough evening, and she would leave, and I wasn't sure whether she was coming back. You know, and having kind of my children, I'm wondering if they can have a mum in the morning. It's really difficult.
Were you told about any support groups that you and your family could go to get that extra bit of help that you needed and to really talk about what was happening to you?
Yeah, there was. After Natalie was in the mother and baby unit, I was invited to a family connections group, which was brilliant for me because it's the first time I've been able to speak to anybody really about what I was going through. It gave me a lot of coping skills and quite a few strategies and a bit of perspective that it's not just me and Natalie going through it. There's other people, and there's other people that are going through harder times for sure as well. But yeah, I definitely got some support and it was definitely worthwhile.
And how would you like health professionals to engage with and help people who are suffering with complex PTSD?
I think if someone could get engaged with us or other sufferers sooner, it'd make a whole heap of difference. It just took so long for us, probably 7 years, I think, until we actually got something that was beneficial for both myself and Natalie.
What advice would you give to partners and families who are going through this right now?
From my experience, it's kind of not to get on the emotional roller coaster that Natalie has to go on, to still giving her support that she needs, but in a kind of much calmer place now. And I've got much more tools to be able to do that. And so if there's anything I could pass on, it'd be that, you know, you can still support somebody, but you don't have to go on that roller coaster with them.
Talk to me about one of your lowest points.
So we had a family holiday that was planned for months and we had to go to meet family. And so I put a lot of pressure on myself to be this perfect family unit and everything's going to be amazing. It was just the only word I can describe it is chaotic, and I felt like I had no control.
Nothing went to plan.
No. And it was almost like a door slammed and that was it. So I felt suicidal, but I didn't tell anyone. And I knew that my thoughts had got darker. I literally did not want to be here anymore. And I had this lovely family and a lovely supportive husband, but I didn't know how to manage it. I didn't know how to deal with it. And so we left my family's house, the family's house, and in the car I knew that I had no way of kind of getting through it. And so I said to Phil, I'm not feeling very well. I didn't tell him in what way, I just said I'm not feeling well, and he pulled over and I rang 111 and said, and I was completely honest with the person, you know, this poor call taker, he was incredible. He said, you know, are you in danger? And I said, is your life in danger? I think the question was, or something. And I just said, yes, absolutely. I don't want to be here anymore. And she kept talking to me, this call taker, and she was amazing. And she just said, this is classed as a medical emergency because you've just had a baby and this is really serious. You've got a plan. And they sent an ambulance. I then remember it in fragments. Gave Hattie to a nurse and I'm going to finish. I'm going to, you know, take my own life. And so I left her with a doctor or a nurse and walked out and got found by a policeman about an hour and a half later, who took me back and who was equally as lovely, really lovely. He was doing an assessment and he was very open about it, and I was terrified that he was just going to take her that night because I'd walked out. I think his words were, I can see you're a good mum, but you're having a bad time. And that was quite a human way of putting it. And I thought that was really empathetic, and it kind of gave me a bit of faith that I had done the right thing. And then I got taken to Mulberry Lodge in Winchester, the mother and baby unit. That was a turning point. That was when I got help, like properly got help.
Learning about Natalie's trauma and some of the things that she has gone through, and just this journey with complex PTSD, it really does demonstrate there's so many facets to this. And I think I need to learn more now about the therapy treatments and the options available to sufferers.
So the treatment options for complex PTSD include a range of psychological therapy treatments, including dialectical behaviour therapy, cognitive behaviour therapy, cognitive analytical therapy, or even EMDR, which stands for eye movement desensitization and reprocessing. And the first stage of all of them is making sure the individual can feel safe again, that they've got those psychological tools to be able to soothe the feelings of anxiety and fear and panic that are associated with repeated traumas from the past. The second stage then helps the individual to reduce their avoidance to the past. And so we'll look at how they can face those memories in a skillful way that enables the psychological injuries to be healed. So there are a couple of really important things to think about when you're considering your treatment for PTSD. The first one is that you're in charge of your story, and in psychological therapy, nobody's going to force you to tell a part of your story that you're not ready to tell. And the second thing to remember is that it can be hard work. So you have to feel like it's the right time for you to engage in this process. Just like going to see a physiotherapist, they give you the exercises that you need to heal your injury, but you have to go away and do them every day. It's really important to also remember the family. They themselves are going along this journey and also need help and support. We run something called the Family Connections program here, which invites family members along to find out that they're not alone in this journey, that there are people who are also going through similar things themselves, and to be able to gain that support and learn some skills themselves about how to cope.
Complex PTSD isn't called complex for no reason, and it's certainly not black and white. And I'm wondering if Natalie's experience is the same for every woman. So today I'm going to meet with Lindsay, who's a mother of 5 boys, to find out more about her story.
As a teenager, I was exposed to violence against my siblings and a relationship breakdown, and I was responsible for my siblings quite a lot at a young age, and I felt that I failed them in protecting them. When things would happen, they got hurt. I felt it was all my fault.
Tell me about some of the symptoms that you experienced.
I think ultimately it's just self-destruct. I felt a rage inside of me that couldn't control if I wasn't able to manage those situations, such as the walking on eggshells. So if I felt like I had done something wrong and my partner wasn't telling me what it was, I would smash things, slam doors. I took to self-harming in the end, and at its worst I would put myself in dangerous situations so that I would hopefully have my life ended.
How did you then go and get help?
So I think with my 3rd pregnancy, I had a newly qualified midwife, and I had gone along for a routine appointment, and from the questions that she was asking, I just ended up breaking down, knowing that I wasn't coping at all. And she was great. She listened and she asked the right questions. She wasn't afraid of what the answers might be, and I knew where to refer me on to for the correct help. I still feel that midwife was a particular turning point in that journey. I thought for many years that I had like a split personality disorder or something, because I would be an extreme rage to a cry and wreck, and so I thought there was something like that wrong with me. I think up until that point I'd always associated PTSD with people in the army, and having experiences as an adult like sexual abuse, physical abuse, that I'd experienced myself rather than just being witness to it. So when they said it was complex PTSD, and it just linked in back to everything, back to exactly when I was a teenager, it made so much sense.
Can you tell me a little bit about the treatments that you had and the kind of therapies that you received?
So I did, I think, 2 courses of emotional coping skills. That was with the community team and one when I was an inpatient at Melbury. And I've done cognitive analytical therapy, which I would say has been the change for me. That links in your behaviours, your thoughts, and then how you deal with those situations.
So the symptoms of complex PTSD are the mind's normal reactions to a series of abnormal life events. They make sense given what's happened to this individual. And the good news is that these range of treatments we have for the individual and their families can help them put the past in the past so that they can make sense and move forward and have a life that they really want to live now.
Therapy's hard. It's not. I thought I'd just go in there, have a few sessions and I'd be fixed. It wasn't like that. But I think if you're willing to put the work in, then you can get better and you can kind of overcome it instead of living with this horrible sort of cloud over you that follows you around everywhere and creeps up when you're least expecting. And I think also another thing is that when I went to the doctor and asked for help, I was quite well dressed, and the kids would always be well dressed, and we'd come in and we'd sit down and I'd say, like, I'm feeling suicidal, and they'd take one look at me and they say, you're not.
It wouldn't be the first time that the woman has felt this way, so it's got to a point that they can't continue safely anymore. So to take them seriously, refer them on.
C-PTSD is a stress disorder, and it is disabling. Both women talked about how much they tried to hide from their pasts, which resulted in more stresses for both them and their partners. And it was after having children that this hiding just got too much. But help is available to anyone suffering from this condition. So if you are a health professional who recognises this may be happening for someone in your care, you may be that crucial link for them getting the help they need. So please do refer them to your local perinatal mental health team.
It's not a quick fix, there's no quick fix, but just little baby steps can really help. And thinking like that, maybe that things will get better.
I feel stronger from going through it. I have those skills now to be able to cope with whatever life throws us.